For a facelift recovery to go smoothly, it's essential that we go back and prepare the patient appropriately before they even have the operation. We would like our patients to stop taking any medication that increases the risk of bruising. There are very, very long list of medications that do this. And basically the advice I like to give my patients is don't take any supplements of any kind, and the only kinds of vitamins to take is vitamin C, and that's all you do pre-op. If you have a history of high blood pressure, it's best to have it well controlled before you go ahead with the facelift. So preparation in terms of avoiding various medications, you'll be given a long list of medications to avoid. I will have discussed with you the importance of keeping your blood pressure under control, and we can talk a little about various over-the-counter medications, herbal medications that may or may not assist in reducing the post-op swelling and bruising. Obviously, what we do during the operation and the immediate care in the recovery room are most important. And with a facelift, it's imperative that we control the patient's blood pressure. In all likelihood, you'll be put on some medication which will control the blood pressure, because any increase in blood pressure will increase the bruising, the swelling, and most of all, the risk of bleeding. We also like you to be rested and calm. This is why I prefer for you to stay in our facility overnight, where you'll be kept comfortable, blood pressure will be controlled, any unlikely nausea will be controlled. What you should expect and what you should do when you leave our facility and go home, we'll give you a list of instructions to follow, but it'll have to do with keeping your blood pressure under control, avoiding anxiety, keep your head elevated. Although we encourage you to move around to prevent any blood clots, we do restrict you. We do not want you engaging in any aerobic activity or anything that would increase your pulse rate, as that again increases the risk of swelling, increases the risk of bleeding. How long will it take for you to recover? The facelift itself leaves you with a very little bruising and swelling. Most of the bruising that we see is around the eyes when we include an eyelid lift with a facelift, and the reason for that is that there's a lot more blood vessels around the eye, the skin is much thinner, and it bruises a lot easier than the rest of the face or the neck. In general, by about 3 weeks, your face will be recovered enough that maybe with a little makeup, you could be out in public and not have everyone wonder whether you've had any procedures on your face. The bruising from the fat grafting and eyelid surgery may take a little longer, and of course, we've had patients that at 10 days appear that they're fully recovered, no telltale signs of swelling, and others take a little longer. So this is very much an individual thing. Post-op, we ask you to restrict your salt intake, as that increases fluid retention and swelling. Everyone wants to know when they can go back to exercise. That's based on how well your recovery is going, but usually we like you to refrain from any aerobic exercise or anything that pushes up your blood pressure for at least 2 to 3 weeks. In some cases, we'll extend it further. In some of our patients who have a little more swelling than others, we may put you on medication to control that swelling. But to summarize, to make your post-op recovery smooth, we start beforehand by working on some medications that will accelerate recovery, restricting those that will increase the risk of bleeding, and then of course afterwards keeping the blood pressure under control, resting, keeping the head elevated, and in general following our instructions. We would be checking you regularly, and we can adjust the time when you can start exercising, the time when you can resume taking aspirin or the NSAIDs, non-steroidal anti-inflammatory drugs.